back. CHKD Therapy Services will be hosting a conference at CHKD Oakbrooke Health Center on August 30th through the 31st to provide advanced training to speech-language pathologists on stuttering. It's called Early Childhood and School-Age Stuttering Therapy, a Practical Approach. So stuttering affects actually over 3 million people in the United States, and speech therapy can help manage it. So here to tell us more is CHKD Therapy Services Supervisor Dorothy Wise. Thank you so much for joining us.
Sure.
So a lot of us have heard about stuttering, but what exactly is it, and how can people benefit from therapy for stuttering?
Okay, so stuttering is a communication disorder in which the flow of speech is disrupted by prolongations, repetitions, or blocks. And that also could be associated with unusual facial movements or body movements. Now, preschoolers do go through a period of normal non-fluency, we call it, but 75% of those children will just recover naturally. The problem comes in if it persists past 6 months to a year, and so that's when we recommend families to seek out professional help if that persists, because if we treat the child in the preschool years, the stuttering can resolve. If the treatment is delayed, it could persist. It can still be managed, but the stuttering can persist.
So you were saying, you said kindergarten, right? If it persists, what do parents need to know? Is it maybe once a sentence, once, every couple minutes? What are kind of the signs that your child might need some help?
So there is normal disfluency and then there's stuttering. So the typical disfluencies would be whole word repetitions, phrase repetitions, or revisions that we all do in our speech. The things that they might be looking for that are atypical would be part word repetitions, sound repetitions, blocks where they get stuck and can't get the word out. Those are the things that we would consider atypical and want to teach them techniques to change their timing and their tension of their speech.
And how do parents make sure their kids get the proper help they need?
So the first thing they can do is talk with their child's pediatrician and ask for a referral to a speech pathologist who is experienced with treating stuttering. And some of the other things they can do is when they are speaking with their child, make sure that they are speaking in an unhurried manner and pausing frequently, reducing the number of questions that they are asking their child and more commenting in conversation, and also listening to the content of the message and not the way it's conveyed.
Absolutely. And let's say there is a referral. What are the therapy approaches that are taken with the child typically?
So typically it depends on the age. So preschoolers, what we're doing is we're fostering fluency. We're teaching them fluency enhancing techniques, showing them how to change their timing and reduce the tension. As the child gets older, if the stuttering persists, we're going to be asking the child to modify the stutter. And there's we can cancel out the stutter or ease out of a stutter. And again, the two main things we're doing is we're changing the timing and the tension of the child's speech.
Perfect. Thank you so much. Obviously, a lot you can do to help your child. And all this information has been posted on our website, 13newsnow.com.